Do you know what anemia of acute or chronic bleeding is? It's a specific type of anemia that arises when there's a significant loss of blood. This can happen suddenly, referred to as acute, or it could be a gradual loss over time, known as chronic. This condition is not just a buzzword for medical professionals, but an important health topic for everyone. Knowing about this condition is crucial for anyone in the medical field, or for those who simply want to understand more about their health. So, what causes anemia of acute or chronic bleeding? Well, the causes of acute and chronic forms of this anemia vary greatly. Acute anemia often stems from sudden and significant blood loss. This can occur due to traumatic injuries, major surgical procedures, or even childbirth. In these situations, the body loses a large volume of blood in a short time frame, leading to an immediate drop in the number of red blood cells. On the other hand, chronic anemia results from slow, continuous blood loss over a prolonged period. This can be due to long-standing conditions like stomach ulcers, intestinal polyps, or cancers. Certain medications like non-steroidal anti-inflammatory drugs can also increase the risk of bleeding, leading to chronic anemia over time. In both cases, the body is unable to produce enough red blood cells to replace those lost, leading to anemia. Understanding the causes helps in effective diagnosis and treatment. What are the symptoms of anemia of acute or chronic bleeding? Common symptoms can range from fatigue, pale skin, shortness of breath, to dizziness. The severity of these symptoms can fluctuate, being either mild or severe, largely hinging on the volume of blood loss. It's important to note that these symptoms are not exclusive to anemia, and can be indicative of other health conditions as well. Diagnosis of this form of anemia usually requires blood tests, which can reveal a low red blood cell count, a key marker of anemia. In some cases, additional tests might be needed to pinpoint the source of the bleeding. Timely recognition of symptoms and proper diagnosis can make a significant difference in treatment outcomes. How can anemia of acute or chronic bleeding be treated and prevented? It's a question that demands our attention. The treatment for this type of anemia is primarily focused on two crucial aspects: halting the bleeding and replenishing the body's blood supply. Depending on the severity of the condition, this may involve surgical procedures, blood transfusions, or medication. Preventing anemia of acute or chronic bleeding is as important as treating it. Strategies for prevention encompass regular medical checkups to catch any signs of trouble early on. Moreover, maintaining a healthy diet rich in iron can help ensure your body has the necessary resources to produce red blood cells. Managing any underlying health conditions is also key to preventing this type of anemia. Remember, early detection and appropriate treatment can significantly improve the prognosis of anemia of acute or chronic bleeding. In summary, anemia of acute or chronic bleeding is a condition characterized by a decrease in blood's capacity to transport oxygen, often resulting from blood loss. The causes range from trauma to medical conditions like ulcers or cancer. Symptoms vary, but fatigue and pallor are common. Diagnosis typically involves blood tests, while treatment and prevention strategies depend on the underlying cause. Stay informed, stay healthy, and remember, knowledge is the first step to prevention and treatment.